to aspire to? That's really good.
It is.
Really good
I think
point.
that we've not cracked that up until now, and you'll have noticed in the slides that actually on our scoring scale, we think there's a focused bit of work we need to do with you and our other partners to actually get better at setting out what outstanding might mean, but in a way that doesn't prescribe it, doesn't limit innovation. Rolling systems should be one of the core processes.
I would say, yeah, I think good arguments on both sides for we versus quality statements. I think this is obviously something that I think we can have some really great engagement on with people, and also the that piece about how we describe what outstanding care looks like and how we're clear around that.
Mm-hmm.
So sorry for the silence. I think it's just the phenomenon known as sticky teams, I think, where kind of certainly from scrolling up and down is not as responsive as it might be just at the moment. I just wonder if any one of the facilitators just want to stick your hand up just to give us a quick 2-minute summary. I think Sarah, you've got your hand up.
I do have my hand up. It was for a question that came up in our room that I wonder whether you might be able to answer, just about the timelines for this work.
Yes, so we're at the early stages of this work, and I think what we're looking at here is what CQC's model will look like after April 2022 at the outset. So there is obviously a lot of work coming out of our strategy, and a lot of work on the kind of systems and processes that underpin this. So I think there is going to be a kind of good lead-in time on this for people. Sorry not to be more specific, but yeah, this is a longer term development.
Thank you.
Mark Platt, you've got your hand up.
So, just a quick from my memory, because I wasn't taking hand notes, but I think the general direction of travel is something that people felt they agreed with and liked, but the devil's in the detail. And I think that challenges about how we can make this workable for individual services. There was a concern as well about how this will connect with the developing ICSs and the system level working. So, how can we make statements that apply to an individual service, also configure in the issues relevant to systems and pathways. One point that was raised, which is sort of an elephant in the room, which I'm not sure we can deal with, but I think is one we might have to have some thinking about, which is about the economics that underpin the current health and social care system and how those impact on the provider's ability to meet some of those statements, even if they really want to, for example, on staffing. And then, as ever with these discussions, colleagues wanting to know, well, how does this connect to my ratings? How is this going to help me to move forward and to reach outstanding? But also, one point allied to that, which is how do we make sure this doesn't also then become the gaming of, what do I need to do to get, outstanding, irrespective of whether or not I'm providing good care? So how we can make sure this doesn't become a points for prizes, but actually does support better care and better experiences of care for people.
So great set of balance points there. Thanks, Mark. I think we've got time for one more quick bit of feedback, and then I'll hand back over to Steph, I think, to wind things up. So just looking at the hands, I can see Graham Whitfield.
Hello there. I've just got three points. I think it's overlapped with lots of stuff in the text. There was some concern around the description of good, when actually good, as David was pointing out, is often satisfactory and compliant as a set of minimum standards. And we know there's bunching either side of the line. And I think there was it's not a new issue, but it came up in our discussion about but also in terms of about rating of providers and rating of areas. How will we contextualize that work there? The second part, and I think this was it's certainly referred elsewhere, about the way in which we collect information. So if we are inspecting at different rates, not at fixed rates, can we make sure that we use pre-inspection data that providers spend a lot of time putting together? How can we make sure that we use that effectively and make sure that it's it's part of our smarter regs piece of work, and how can we communicate that to providers? And the final part was about there's a real positive thing about the ownership of the we and the I statements, but concern that we risk losing some of the details. So obviously there's a real challenge in how we go about that, but there was a positive aspect in terms of the challenge for simplifying things. But the key part of that was ownership. It sent out a positive message of ownership of it.
Great, thanks, Graham.
Yeah, thank you, Graham. Okay, so we've got a couple of minutes left. So, Steph, was there anything that you particularly wanted to say, or shall Dave and I just do a quick summary of kind of where we go next with this?
Yeah, that would be great. Thanks, Amanda. It was just one quick point for me. I'll just be popping a link to the feedback form in the chat if everybody could take a couple of minutes just to give their feedback on how they think today's session went. That would be wonderful. Thank you.
Yeah, and it would also be great. Very happy to kind of take further points, questions, information from people on the call, because I think we are obviously keen to engage as widely as possible on this. So I think in terms of next steps around this work, say we're at early stages. We're kind of starting to tease through what this might look like for the future. There will be opportunities for further engagement. I think from this meeting we'll pull together a summary of the feedback which we can share with people on the call, from a look at the kind of comments and what we've heard from the facilitators. It sounds like that were really good, rich discussions in the calls, very balanced. Sounds like lots of really excellent points coming out of that. So I think we'll make sure that we're also really clear about how we're using the feedback that we've had from you, and then what the further opportunities are to engage on this. Dave, Laura, anything more that you wanted to add?
Well, just to extend my thanks really to everyone for attending and giving your time, especially, as I say, given it's probably quite uncomfortably hot wherever anyone is, but this has been really helpful. There's a lot of really rich material there for us to take away and for us to take this to the next stage. And you will be hearing from us again throughout the summer, and I hope it stays as warm as this. But let's see. We are in England after all.
And also just a slide up on the screen about kind of how to stay up to date and get involved. So also lots of ways, other ways to keep in touch and to feedback into CQC. So yes, thank you everybody, and see you soon, hopefully.